I'm Dr. Daniel Kantor, Neurology in Real Time, and I'm joined here by Dr. Ted Rothstein from Washington University. You're a professor of neurology there, and you looked at something called gray matter. Can you tell people back home a little bit more? What is gray matter? I thought MS was only about the white matter.
Well, that was an ancient concept, that MS is a white matter disease. But we are finding increasingly that the gray matter is a critical factor in patients' symptoms, especially those symptoms such as memory loss, fatigue, and sometimes motor and sensory symptoms that are just not seen on a standard MRI. And what we have been doing for the last several years is using advanced imaging techniques, using a standard MRI with additional time spent, another 7 minutes in the scanner, plus very little additional expense to analyze gray matter structures in the brain. We know that 70 to 80% of MS patients have cognitive impairment, and it's not explained by what we see on a standard MRI. But if you do a test such as the NeuroQuant test, which analyzes in 3 dimensions the volume of different gray matter structures, like the hippocampus, which is the seat of recent memory, or the cortical gray, which is critical for memory and thinking, you can see all of these numbers are the first percentile for their age, which means that 99% of these MS patients have less brain cortex than the rest of the population. 99% reduction in gray matter. And here in the hippocampus, 5 of the patients had first percentile, and 2 of them, one was in 6th percentile, another was in the 11th percentile. So 7 of our 10 patients had substantial loss of the hippocampus. So we are starting to understand why patients are experiencing some of these very serious symptoms, which is having a profound effect on the quality of their life.
Well, Dr. Rothstein, I want to thank you so much for explaining to us why gray matters too. And I want to thank you for joining us. And I want to thank all of you back home in Real Time Neurology.